I might have treated few thousands of sciatic patients in the past 23 years of Ayurveda practice. However, some patients they remain in the recall. This patient, a man of in his 30s, was brought to the clinic as supported by his wife. I noticed the way he was walking, bend his body towards one side while walking, with an abnormal throwing action on one leg. He even denied sitting or lying on the examination table, saying it is more painful. He was crying and mentioned me that there is something pulling inside his left leg. I really saluted in mind the ancient Ayurvedic physicians who named a disease Gridrasi. The condition was identified and recorded in 700 BC itself by Susruta, who is considered as the father of surgery. Gridra in Sanskrit, it means the bird vulture. The word Gridrasi itself suggests that the gait of the patient is similar to that of a vulture, that's like a gait with abnormal throwing action. Another meaning of the word Gridrasi is the deep piercing or the pulling pain, as if a vulture is eating flesh with its sharp beak. Sciatica is one of the most excruciating and irritating pain of any neurological pain. This patient, with his narration of pain, literally drew the anatomical course of the longest nerve in the body, the sciatic nerve. He explained in tears, excruciating pulling pain starting from the low back, radiates all the way to the foot, traveling behind the thighs, behind the calf, and on and off pricking sensation, twitching or pulsating like an electric shock wave, numbness, and he is unable to feel the foot. I diagnosed him as a typical type of Vada Gridrasi, which is triggered after lifting a luggage. There is another type of Gridrasi which is mentioned in Ayurveda called Vada Kapha Gridrasi, with symptoms of loss of taste, reduced strength in the leg, and heaviness of the leg, etc. The treatment is slightly different in each type. In the celebrated Ayurveda book, the Ashtanga Hridaya, which was written in 700 AD, it clearly mentions that the movement of lifting of the leg is restricted in Gridrasi. Now, restricted straight leg raising or restricted SLR is considered as the clinical confirmation of sciatica. I suggested this patient to lift his leg. He was standing, bending his knees. He refused to even straighten his leg. What is SLR when you are in an excruciating pain? The confidence of an Ayurvedic doctor treating sciatica is coming with an experience of Ayurveda treating sciatica over 2500 years with herbs and therapies. I tried to rewind, all the Sanskrit slokas mentioned in the Ayurvedic principles of treating sciatica. But I didn't find any of them suitable for a patient who is unable to sit or lie down. And I didn't want to cause any further irritation on his firing nerve with oils or therapies. Actually, I thought of doing a thermocautery on his little finger as suggested by the Ayurvedic books. However, realized the practice limitations quickly. I started some nerve tonics mentioned in Ayurveda, and I asked his wife to prepare a potoli, a herbal compress of powdered horse gram, keep it in the steam, and apply gentle heat on his low back and legs. Also suggested complete rest for 2 to 3 days by keeping 1 or 2 pillows beneath his knees, and to report me after 3 days. Ayurveda recommends some do's and don'ts in sciatic patients. I tell most of my sciatica patients to reduce dry food, lentils and dals, cold food, spicy, bitter and astringent taste, untimely eating, dieting and fasting, overexertion, keeping awake at nights, suppression of urges, uncomfortable postures, etc. And this patient, he came back after 3 days with a gentle smile. However, reported some numbness, weakness and low back pain. I have sent him for an X-ray which indicated early wear and tear changes of the lumbar vertebrae termed as the lumbar spondylosis. I changed the course of treatment to that of classical treatment of gridrasi or sciatica with medicines and some heat therapies and oil therapies like kiri, kadivasti, etc. And this patient, he got out of the symptom beautifully within 3 to 4 weeks. Still persisted some numbness on the toes. I have further modified the treatment approach to that of lumbar spondylosis together with some nerve tonics and to be continued for a month time. However, I never saw him thereafter. Patients are like that. They disappear either if completely healed or not benefited. But I met him in a mall after an year who was walking with the family doing some shopping. He came towards me and we spoke for a while. He had actually dropped the medicines in between as his symptoms went away. I felt he didn't give much value to my advice of taking care of his lumbar spondylosis. I wished him happiness and health, and he thanked Ayurveda.